Every year, more than 2 million people in the U.S. are infected with a bacteria that has become resistant to antibiotics. New research suggests one of the ways we've been trying to stop the rise of superbugs may have actually been making things worse.
Strep throat, urinary infections, and even some types of pneumonia. It's the medicine that kills bacterial infections, antibiotics. Doctors' orders have always been to finish your course of antibiotics, even if you're feeling better, because not doing so would make you prone to antibiotic resistance. But now researchers are saying there's no real proof behind that idea. Taking antibiotics, when no longer needed, may actually increase antibiotic resistance. So should you stop taking your antibiotics once you're feeling better? Or is it too soon to drop this decades-old advice?
And joining us now to help us discuss the new research on antibiotic use is internist and gastroenterologist Dr. Partha Nandi, as well as internist and infectious disease expert Dr. Brad Spellberg. And I'm just going to start this discussion off and acknowledging that the two of you have opposing viewpoints on this new research. Dr. Nandi, I'm going to start with you. What is your take on the new studies?
Dr. Travis, I think it's borderline irresponsible. You know, I'll tell you a story. I had a patient, Willie. Willie was a guy with lung disease, and he had an infection. So Willie, instead of taking it for 14 days, decides after 4 days, he's okay. So then, of course, he comes back, and he's much worse. I have to admit him to the hospital, ICU stay. We almost lost him. So my point is that, you know, listen to your doctor. If I tell you, I want you to take it for 10 days, please believe me. Don't think that, I feel good, I should stop taking it. I really feel strongly that, yeah, this is a great debate for a medical conference, but my patients should not decide because they can get in real trouble.
Dr. Spellberg, you look at this very differently.
Yeah, I think we're not even asking the right question. We have now dozens of randomized controlled trials that demonstrate that short-course antibiotic therapy, usually on the order of about 5 days, is as effective as longer courses that have historically been used. And in several of those studies, there was less emergence of resistance with short-course therapy. If I prescribe a short-course regimen, patients are not going to feel much better before they finish. It's an irrelevant question. If by some chance they feel much better the day before, they can pick up the phone and give me a call. Medicine is a team sport, and I agree patients should not be cut loose to make decisions on their own. They should contact their physician and make a joint decision. But there have been dozens of randomized controlled trials across numerous types of infections in adults, which unequivocally demonstrate that short course therapy is as effective as longer course therapy with reduced emergence of resistance. To say otherwise is factually incorrect.
In my opinion, we need more studies, and if we have studies saying that we can give a 5-day course as opposed to a 10-day course, I think that's great, that's ideal. But what you're saying is once a person feels better, you're saying that that bug is gone and they should be okay to come off of the antibiotic, even if there has been a study that says they should be on for 7 days. If they feel better after 5, you're saying you feel as though they're good to come off.
No, I think you are conflating the message.
Okay.
The message is start with short course therapy. If you start with short course therapy, the question of stopping early becomes largely irrelevant. Now, if some patient says, look, it's day 4, the redness is gone, the swelling is gone, I feel fine, pick up the phone and call me. I very likely will say, go ahead and stop. That is a rare occurrence with a 5-day course of therapy. If I give 2 weeks, which is Dr. Travis has pointed out, the evidentiary basis for 2 weeks was Constantine the Great deciding in 321 AD there's 7 days in a week. I call them Constantine units. It is a completely arbitrary course of therapy. It has no evidence behind it.